Hello, everyone. Welcome back to Take Back My Brain. I am your host, Lori Hammer, and today I have a very fun guest. We are going to talk about myofunctional therapy. And if you're like, I don't know what that is, that's why you need to stay and listen. And you need to share this because every single person on the planet needs to know about myofunction therapy. And so I have an amazing guest. Her name is Karese Laguerre, and she is a myofunctional therapist. She was a dental hygienist in the past, but now she has taken all that expertise and channeled it into what she is currently doing now. And she has written the amazing book, Accomplished: How to Sleep Better. So if you want to know how to sleep better, this is going to be an amazing podcast for you to eliminate burnout. So we're going to talk about so many things with your mouth and everything that helps with burnout. So I can't wait for this and to execute your goals. So, Karese, welcome to the podcast.
Thank you so much for having me. It's a pleasure to be here.
I love it. So you were a dental hygienist and then you went into more of the myofunctional therapy. So I love talking about the mouth because so much health begins in the mouth. And that's what I teach my clients, with amalgam fillings and do you have cavitations and all those kind of things. But one area that has always fascinated me is this myofunctional world. So can you kind of tell us a little bit about what is myofunctional therapy and how you got into it?
So, myofunctional therapy is kind of like having a personal trainer for all the muscles below your eyes, but above your shoulders. I work with all these wonderful muscles here to just help them function properly because when they're
Hmm.
in dysfunction, that's when everything starts to fall and we get a cascade of events because just like you mentioned earlier, like health really starts here,
Guys, yes.
goes down. And so, we want to make sure that all of the muscles that are supporting that area are functioning well. So I got into this through my children, really. And I think as parents, a lot of us wind up, down
Oh,
unexpected
all the
roads.
time, right?
Yeah. So I have four children,
Wow.
and I think as parents, we always like give the highlight reels, right? So if somebody's like, "Oh, how's everything?" We're like, "Oh, great. This one's soccer, or we got a dance recital over here, or we talk about all like the wonderful good stuff." But I have a lot of stuff going on in my home that I wasn't talking about, and it was a pediatric dentist that really like brought everything to light for me. So some of the things that were going on in my home, my son is my only boy, and he had a lot of emotional and behavioral, like
Hmm.
disruptive behavior. He was unable to focus in school, very classic ADHD presentation of symptoms. And my oldest daughter, so then there's three girls after the boy, but my
Hmm.
oldest had every sleep issue under the sun. I mean, you name it. Every night we were guaranteed bedwetting. It didn't matter what time I said, okay, no more drinks after this time, guaranteed it was going to happen. So
Right?
bedwetting for a good 10 years, night terrors, blood
Hmm.
curdling screams in the middle of the night, tossing, turning, falling out of bed, snoring, grinding. I mean, you name it, she's
It was
done it.
happening. Oh,
Yes, yes. And then the younger two had a lot of upper respiratory issues. So it was the chronic, ear infection, throat infection,
yeah.
nose congestion, like all the time. Something was going on up there, and they were having very much challenging times just trying to breathe. And I had no idea that all those things, like these children are very genetically similar, and all of these things were just so interconnected to the way that they were using their facial muscles, the way that they were breathing, the way that they were managing or able to manage their autonomic nervous system. And once I really discovered that there was this whole underbelly
Yes.
of myofunctional therapy out there, and I started to see what it was doing for my children, I just dove in like
Right.
hard. It was time to help other people get to the other side of
I
the
love it.
dysfunction.
Yeah. So you were mentioning your children had night terrors and bedwetting and all of those things, focus issues. So can you connect the dots for us and maybe like go through each one of those and say, this is what was going on? Because I know from, my personal experience, with one of my children, we had some bedwetting issues, and it wasn't until we started doing cranial sacral therapy that that bedwetting stopped. So it's still, moving and changing things. But she still had night terrors and, other things. And once we started working on the mouth, actually they increased for a while and got really, really bad, and then they eventually got better. But I would love for you to touch on that because I don't think we're trying to manage all those things, and it could just be a structural issue that
Right.
could be taken care of. And so you can't medicate it away, you can't talk it away, you can't, all those things. So address this for us.
Absolutely. Absolutely. So my son, my oldest, with a lot of his emotional and just dysregulation, his inability to cognitively manage his responses, a lot of that really did line up with what is ADHD or what you would classify as
Sure.
ADHD. But I think it's important for all of us to really remember that ADHD is a symptom based diagnosis.
Hmm.
There's no MRI, CAT scan, blood work. Like there's nothing that's going to say, oh, yes, we found it. Like this is
Right.
it.
Yep.
ADHD.
This is the cause.
Exactly. And then you're very limited once you're already in that box of diagnosis. You're very limited as to what you can do. Like they want to throw medications at you
Yeah.
and all sorts of things. And so we went that traditional route until I found out what I learned later on. Now, once I started to get into the world of myofunctional therapy and I started to learn how important sleep was to overall function and then the children and development, specifically their cranial development, like their
Hmm.
cognitive and emotional regulation, all of that, I started to see how everything kind of came together. We were seeing a phenomenal pediatric neurologist that we waited months to see before we originally got in. And then we went every 6 months. And on our third, recall visit where we were going to go see her again, I had come across all this stuff. And I just mentioned to her very lightly, like, no, I don't want another medication because so many of the medications didn't work for my child.
Right.
So no, I don't want another prescription. I don't want another medication. What I want to do is I want to actually look into his sleep. And before I could start to reveal to her what exactly it was that I was starting to learn and how it was interconnected, she started to explain it to me. So
Ooh,
she said, whoa, whoa, whoa. You never told me anything was wrong with his sleep. And I'm just going to interject here to say that I was never asked.
you were
So
never asked. Yes.
yes.
Yeah.
But she said, you were never told me that anything was wrong with his sleep. Because if you did, I would have told you there's this 70% overlap in the symptoms between children who don't get good sleep. So sleep deprivation in children manifests with 70% similar symptoms to ADHD. And that was just such a mind-blowing just revelation to me. Like she knew that already. And we had been through so many different medications with my child, and that was never explored as an option. There's so much you can do with sleep that are these natural solutions to help make it
Right.
better, even if
Right.
it's something as little as, just using a nasal strip. And now he's got a nasal strip, and like none of that was ever presented. So I think it's
Which has
really
got to be
important.
frustrating for you knowing that she'd been walking this journey with you and hadn't said, "Hey, how's his sleep?"
Yes, yes. But it also did confirm for me that I wasn't, because when you first come across something new and it's alternative, you feel like,
Mhm.
oh, am I being like a little bit of a hippie? Like, am I out there? But this was somebody who was very well respected in the
Sure.
profession who knew this thing. And so I'm like, oh, this isn't even some underground something. Like
This
people,
is legit. Yes.
yeah, people know and understand what this is. So I think it's very important that we always have that conversation with the ADHD and the ADD diagnoses, because those are just symptom based. Like these are not things that you can say definitively this is the thing. So it's
Sure.
always important to rule out some other causes. So with my son, that's that. But with my daughter and the sleep is something that you would be surprised they get very little education on in medical school.
Yeah.
We really, as dental professionals, I went to a very respected university for my hygiene degree. I was right along the dental school, and we got very little information about the correlation between breathing and sleep. And it wasn't until I started diving into these wonderful worlds where I was getting all of this additional
Right.
education that I discovered that's breathing is really what's helping us to regulate our sleep. People talk
Who
all the
knew?
time about pillows, about mattresses, about light exposure at night. Like you could do all of those things. You can get all of the tricks in the world. And if you're not breathing right, none of it matters. So you can't regulate through your sleep stages if you're not adequately breathing. And one of the big things that gets in the way is that there's so much muscle surrounding, so much soft tissue, I should say, and muscle that surrounds our upper respiratory tract. And one of the first stages of sleep, stage one, muscles start to relax, and it only gets deeper after that. So as you start going in towards REM, the muscles are really relaxing. And now you're putting yourself at a risk because you're also lying down horizontally.
Right.
So now we've got added gravity. So more gravitational pressure, your muscles are relaxed. Now we're at a risk for the airway collapsing. And that's where we get these gasping, where people wake up and they feel,
Yeah.
and they have to take a big breath because they weren't breathing for a short period of time. It's just opening back up their airway. So anytime that happens, that disrupts any sort of restorative processes that are happening in sleep, and it disrupts just bodily functions. So now our chemicals are changing and our signals are changing. So when we have children who are bedwetting, it's because of the oxygen desaturations that are happening in their body. Now we're getting new neurochemical signals just saying, hey, we're full. Bladder is full. It needs to empty. Empty now. And it might not even be full, but it
Right.
can't hold anymore. And so now it empties. But the children are still kind of partially in between sleep stages. So they don't even realize sometimes that it's happening. It's not that they're waking up and they're too lazy and not getting out of bed. Like,
Right.
this is the start of that type of parasomnia, in addition to other parasomnia. So, like I said, my daughter went through a lot of things. We did the sleepwalking, the sleep talking, like a lot of that is happening as a result of the body being dysregulated under sleep. And so you're not getting those restorative stages because the sleep gets interrupted with these little micro arousals and the body is kind of going haywire. And
Wow.
so there's a big connection there that I don't think enough of us think about, because who's thinking about breathing? We think of it as just like this automatic
It's just
process,
automatic. Yeah.
right? But it's not that automatic when we're asleep. And so it's really important. And just to kind of create a beautiful analogy here, and feel free to stop me anytime I kind of ramble. I'm very
No,
passionate
you're
about
good. This is fantastic.
it. But the analogy here that kind of brings it back to what I do with myofunctional therapy, how I said I'm like a personal trainer. I want you to just envision a person, it could be a man or a woman or whoever, on a beach, and they've got six-pack abs. And we're going to have them lie down on the beach. Now, they've got additional gravitational pressures on their body. Will those six-pack abs still remain the same? Absolutely. Nice, strong, firm musculature. It's not moving anywhere. Gravity's putting extra pressure, and those abs are still there firm. Now, let's picture a different person with more of a beer belly shape. So they've got more weight on the midsection. And we're going to lie them down. So they're going to lie down on their beach towel. Does that belly still sit upright in that beer belly shape? No. Everything shifts. This is not firm, strong tissue. This is tissue that's,
Floppy.
yeah,
Yeah.
yeah. That's the best way to describe it. There's no like great medical word for it.
Right. It's squishy.
Yes, this is squishy tissue. And so everything starts to change. If you think about all of the tissues that are surrounding your upper respiratory tract, they're
Mm-hmm.
all, if you're not working on them, the same level of squishy or floppy. And they're more prone to losing shape and form as you lie down to go to bed, and then muscles start to relax. And so you're already creating an environment where, we like squishy things because
Yeah.
we, the cuddle, the closeness, and those squishies, they tend to fall into each other as opposed to strong, firm tissues that
Mm-hmm.
can hold themselves open. And so that's where the work that I do as a myofunctional therapist really comes in, into helping people to maintain more open patent airways so that they can get more restorative sleep, so that they can start to now be able to better regulate their bodies. And now we can get into better systems that help us function throughout the day and help us gradually over time improve our systemic wellness.
I love it. Can we go back to the bedwetting for just a second?
Absolutely.
Okay, so can you re-explain to me like what is happening when that signal comes and the bladder says I need to empty?
Yeah. So oxygen is, they're losing oxygen. Okay. So that's the correlation that we have right now as for why bedwetting is happening. So you're going to sleep, you're starting to lose oxygen. Imagine it as obstructive sleep apnea, although it doesn't have to be a diagnosed obstructive sleep apnea
Okay.
for this process to happen. Okay. So the airway collapses, you're losing your oxygenation, it goes down, you're in the 80s. Like we really ideally want it to be in the
Mm,
90s. That's how we're
right.
getting our best blood flow and so forth. Um, it's in the 80s, and now your body is not able to regulate those sodium channels in the same way, and so now your body is saying we have too much, it's too full, the bladder needs to empty now, like
Hmm.
immediately. And so the bladder will empty, but that doesn't necessarily mean that you get the arousal. You might not be in a
Right.
full waking state. There's a lot of us who we go through as we cycle through every 90 minutes, roughly. We cycle through all of the sleep stages if you're sleeping optimally. And
Hmm.
it's not every 90 minutes that you'll wake up in the middle of the night, right? You might
Right.
not even be awake, but your body is moving and you're awake from one state going into the next.
Another. Sure.
And so that's what's happening. They're not really getting fully aroused to bedwet and to
Sure.
the body is just releasing and emptying the bladder because it's like, oh, sodium channels too high, potassium, we have to let it go. Let it go
Right.
now.
So could that also, so that's kids, but could that also be happening? Like I have a lot of women who are like, I get up, or men, get up, two times a night to pee. And they're like, I don't even really pee a whole lot. It's not like my bladder is full. So is that the same kind of thing? But as adults, we're aroused enough
And
to
you
know,
get
like,
the
hey, I'm
arousal.
good. Yeah.
Exactly.
Yeah.
Exactly. And some people are not even fully, so adults and sometimes the children do get fully awake too. Um, and they make it to the bathroom. But sometimes people don't want to fully talk about the fact that there are times where you don't make it.
Yeah. 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 I mean, because who wants to talk about that, especially as an adult, right?
Exactly.
Yeah. Yeah, for sure. Okay,
So
that's
there's no
amazing.
shame if it
No
happens.
shame. There's a physiological reason for it. And so often, I'm thinking about some clients that had to go down like the bladder specialist, all those kind of things when it could really just be the way that you're breathing. Or, I love it. Now I have some mamas coming to see me with their kids and we're working on nutrient deficiencies and stuff, but they're also going to, a biological dentist and they're working on opening the airway, and all those things, which it's becoming more aware, Carice, right? Um,
Yes,
but there's still a huge disconnect there because we just don't really think about our mouth and our facial muscles. And I'm always teaching we have to deal with the head first. We have to deal with the brain first, up here, the head first, and then everything below the neck gets easier to deal with, right?
absolutely.
Yeah.
Absolutely.
Can we talk about snoring and what is because usually you hear snoring is, it collapses. But how does that affect us? Not just our sleep quality, but our cognition the rest of the day.
Absolutely. So snoring, if you think about it, yes, people say it's the vibration of the tissue because, everything is sort of collapsed on each other. It's a narrower space. But if you think about it from the air perspective and not from the soft tissue perspective,
Okay,
sorry, I had a cough.
you're good.
Pardon me. If you think about it from the air is meeting resistance.
Okay.
So as you're trying to inspire air, the air is not able to adequately flow through.
Mm,
And so it's forcing its way through. That's really the sound that you're hearing. Now, what that means is that obviously you're not getting adequate oxygen.
right.
But that now is negatively impacting your ability to go through the cognitively restorative functions that you need to have. So, breath is number one priority for our body. We could go for weeks without food, days without water, but how many of us could go for any more than a few minutes without air?
Right.
So we have to do that. And your body's number one priority is to keep you awake, keep you alive, sorry. And so when your brain is losing that oxygen priority now is not going to be for memory to deposit. It's not going to be for the brain to do its own detox process, the brain to do any sort of immune function, to do any restorative healing, cell regeneration. Like none of that's going to be able to happen. And so that's why you wake up the next day feeling more groggy, super fatigued. Like you can't really function unless, you get some caffeine or something to
Sure.
stimulate. Exactly. Because you didn't get adequate breathing through the night. Now, if you're somebody who's snoring and it's all night long,
Mm-hmm.
you haven't been breathing well all night long. And so you're operating now in that deficiency. And that's
Mm-hmm.
going to impact your autonomic nervous system, which is that rest and digest or fight and flight system, where now you're going to most likely be in that fight or flight because your body has been fighting all
Yeah.
night to keep you alive. And now it's on a catch up. It's daytime now. I don't know why I didn't put water by my desk, but it's daytime now and it can't catch up to all of that oxygen it lost. So you're at a deficit.
Okay. Wow. Okay. And so what do you feel about like sleep apnea machines then? So if somebody has sleep apnea, they go to the doctor, they're diagnosed with sleep apnea, they're not going to address any of the things that you're addressing. Does that compound issues? Are they still getting a good sleep on a sleep apnea machine because now they've got some more airflow or not?
It depends. So with the CPAP, continuous positive airway pressure machine, it's essentially forcing air to open and
Mm-hmm.
keep all those muscles from collapsing. So you're still breathing your own air, but
Mm-hmm.
it's now holding you open. So can it be beneficial? Yes, if you can tolerate it. Not everybody can
Right.
tolerate. And that's the big thing. That's why they have such low compliance rates. It's about 30% of people who are prescribed a CPAP will actively use it
Right.
and will use it long term. So can it be helpful? Yes. But it's kind of just more of a palliative option and not necessarily addressing
The root
the
cause issue.
bigger issue is that we have all of this what we've been terming as squishy tissue in
Right.
the airway.
So what makes somebody have squishy tissue as opposed to the next person?
Ooh, well, not necessarily working on it, not having adequate function. So we have a lot of dysfunction that occurs. People may have improper swallowing patterns, which are going to impact which muscles are recruited and
Okay.
used. You might not be able to, you might have actually more inflammation in the airway. And so if you have more inflammation in the airway, that's could be from a number of things, but likely it could be because there's reflux or some other gastrointestinal issues or imbalance of certain bacteria
Mm-hmm.
in your saliva. So the salivary content might be more viscous or might be
So your microbiome
fluid.
in your mouth, in your gut affects how you breathe?
Absolutely, of
That's
course.
amazing. All right.
Of course, it affects almost everything. This
Everything? Yeah.
biome. We want to have the balance, and we want to have when your pH of your saliva is off by too much, it makes you more likely to be a mouth breather, which makes you more likely to have
Really?
inflammation, which makes you more prone to leaky gut, and like
Wow.
it all goes together.
So how does the pH, why would you be more of a mouth breather if your pH is off in your mouth? Can you explain that?
The pH and the way that it balances against what's going on in the gut and the guts the stomach
Hmm.
acidity, the way that that balance is counteracted and how much of that is swallowing, how much of that is encouraging more backup to come up from
Mm-hmm.
the more of that acid reflux to come up. That's a big reason. I mean, there's also the factor that the tonsils and the inflammation that it would cause upon the tonsils and the tonsillar tissue that is behind the nose. And so that gets impacted too with
Oh, gotcha.
saliva
Okay.
being off.
Okay. So let's talk about the tonsils a second. So can you, if somebody has swollen tonsils, when I was a kid, I don't know how old you are, but when I was a kid, everybody got their tonsils out. Everybody got their tonsils out because then you can breathe better, then you can do these things. But can you tell us what the impact of that tonsils, adenoids, all those kind of things have on your breathing ability?
So the tonsils and the adenoids are there as lymphatic tissue. we need our lymph system because our lymph system is just going to help us kind of remove certain things. It's part of the endocrine system and so forth. So we need that. However, it's kind of like the gallbladder, right? Like, can you live without your tonsils? Absolutely. You could live a long and beautiful life without your tonsils. So it's not necessarily that you have to have it. But when these things are inflamed, when they're creating too much of a blockade of sorts, when they're catching too many things, that's when you're going to lead yourself to more inflammation. Like the lymphatic system does not work like everybody thinks because it's so interconnected, it works like the circulatory system. It's not circulatory
Yeah.
at all. It is something that's a pressure based system. And when you're building up so much pressure because you
Mm.
have these nodules, these big tonsil areas that are full of all this lymph that hasn't been removed in any way, shape, or form, well, that's also creating its own negative impact on the environment around it. And so you're getting more inflammation around the area, the nasal pharyngeal space for the adenoids, the tonsils are really in the middle of our pharyngeal space. And so that's going to impact absolutely everything. More risk for tonsil stones,
Yeah.
more risk for infections and diseases and so forth. So you don't want that.
Right. Absolutely. So even if you don't have tonsils, you can still have airway obstruction. So that's not the only thing that really
Right.
causes that. I mean, you have your soft tissue issues, you have your tonsil issues. What other challenges in the mouth can obstruct, or the things that you work on for airway?
Structural issues. So people who have their mandible, which is that lower jaw, more protruded, and so they didn't get enough forward growth as they
Mm.
were growing. The tongue is actually super responsible, one, for getting up and out of the airway, because when we think about our tongues, I need everybody to remember that our tongues are much more than what you see in the mouth. Like
Yeah.
there's a big body in the back of the tongue that we need to get up and out of that airway. And so that's a big part of it too. Without your tonsils or even a soft tissue, if that tongue can't get up and out of the way, that's a problem. But that tongue is supposed to be responsible for craniofacial growth and development. So when the tongue is not sitting at proper rest, and proper rest posture for the tongue is lightly suction throughout the entirety of the palate. So from the front of the palate all the way back to the uvula, we want that tongue lightly suctioned against the roof of the mouth. Now, when it's suctioned and it's sitting up there, it's going to help create like a big, broad, forward growing maxilla, which is that upper arch or the upper jaw, and the lower jaw follows. When we don't get that, when there's improper rest posture, open mouth rest posture, if the tongue is sitting anywhere other than developing that palate, we're going to put ourselves at risk for having a deficiency in that area because
Mhm.
maxilla, that upper arch, or our palate, which is the roof of the mouth, is the floor of the nose. If it's narrow, if it's very high, like some people know that they have a very high arched palate, well, what do you think the floor of your nose is like? Because that's exactly what is on top, right on top of this
Mhm.
is our nasal space. So we need to be able to breathe. So even if your adenoids are fine, your septum is going to be actually very impacted by that deficiency of the maxilla there too, because that septum, if you have a high arched palate, it's most likely going to deviate one way or the
Mm.
other as you're growing. It's not going to stay straight if it doesn't have a good environment upon which to do so. So without the tonsils and the adenoids, as you asked, the tongue is a big factor. Our maxilla and our mandible and how impinging they are on the space are a giant factor as well. And then your nose and like the nasal structure and whether or
Oh,
not that is adequate for breathing.
so many things
Mm-hmm.
just right here.
Yeah. Yeah.
Yeah.
Yeah. Yeah.
Yeah. So how would you speak to somebody who, so they've done all of the stuff. They've done the pillows, they've done the beds, they do the supplements, they do, everything that can be helpful, tested their adrenal function, we've tested their hormones, and they're still struggling with sleep. They're still going to bed like at 10, sleep for a few hours and they're awake, and then the rest of the night is just kind of kaput. Um, what do you say to that person, Carice?
To be very mindful of their breathing because the breathing might be the final frontier that they didn't check, but like the most important one that they probably should have started with. And it's always sad when you get people who have tried all the things or they all
Yeah.
the boxes and then they find out, oh, there's this major thing that they didn't get. But check the breathing. You want to make sure your daytime breathing posture, because your nighttime posture is most likely going to mimic your daytime posture.
Mm.
So if your tongue is in the right spot, like I said, lightly suctioned up against the roof of the mouth, from the front all the way to the back, not just like the front tip of your tongue, not the front half, like the entirety of the body of the tongue. That's going to get the tongue up and out of the airway during the daytime. And it's more likely that you'll be able to suction, seal, and keep that posture at
Wow.
time when you are subconscious. So our body keeps that same muscle memory. If the tongue is suctioned up there lightly during the day, your lips are closed, you're doing primary nasal breathing, and it is inaudible. So you don't want to hear yourself breathing in any way, shape, or form. Okay. If you can hear yourself breathing, there's some resistance there. So just be very mindful that that's a daytime thing. And so at night, it gets worse, right?
Ah,
Because
gotcha.
muscle
Hmm.
relaxation and gravity. So be very mindful. What is your posture like during the day? Your oral posture? Is the tongue where it should be? Are you breathing through your nose? Is it inaudible? If not, then you're more likely to have that as a causative factor of why you're not getting the restorative sleep that you would like to get. And so I would say 100% contact a myofunctional therapist for further evaluation, and just start to just take better note of how frequently you're noticing these things. Sometimes people start to note it when they're in allergy season. Like as we're recording this, it's
Mm-hmm.
spring, it's early spring. So people might be in allergy season. This might not be how everything always is for you. So wait till you've kind of gotten over a little bit of the hump of the allergies and then start being more mindful about what's
Mm-hmm.
going on. That way you could see where your,
Yeah.
baseline actually is.
Interesting. Um, I just lost my train of thought. Okay, that's a good way to transition into it. So, how does your breathing affect your focus during the day, and maybe speak towards, anybody that I've worked with had dementia also had a breathing issue. So can you address those things?
Yes. I have a lot of close friends who work in memory care and in senior facilities, and they're like, it's always the mouth breathers that are in these facilities. Memory and all the deposition of such, even our short term memory versus our long term memory, all of that happens during sleep. Like, we don't do any memory depositing during the day. Everything you've learned during the day doesn't get like solidified in there until it's nighttime. So how we're breathing is going to impact our body's ability to really engage in all of these restorative processes. If we're able to get through all of our sleep cycles and we can get into that deep REM sleep and our body can really restore, absolutely, you're going to reduce your risk immensely of things like dementia,
Okay.
Alzheimer's, and these memory care issues that a lot of people are having. You want to really, 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 really make sure that you are on top of how you're breathing during the day, because a lot of that is going to impact what's going on at night. And so just be on top of that. Our memory is very much linked to what's happening at night, and the deposition of those memories does not occur without restorative sleep. So
Mm.
it's not, I'll sleep when I'm dead. It's, you're probably bringing yourself to, a worser state while you're alive, not sleeping adequately.
Exactly. I always tell people, please guard your sleep. It is the most important thing. You cannot heal if you cannot sleep.
Yeah.
Yeah. So people get really stuck in that. And I think our society has
Yes.
minimized the importance of sleep. They've like, yeah, who needs sleep? We've got this life. Let's live it now. Let's push, push, push. And, when you read older books, I don't know if you've noticed this or not, but they always make a point like, and we got a good night's sleep before we went and did this really complicated task, no matter what kind of older book it was, they always went to bed and then they got up and then they, dealt with the crime scene or whatever they were doing, you know what I mean? So we don't do that anymore, and it's a huge detriment. And then I think you probably get in this hamster wheel cycle where you're just not getting out of it. If you're not sleeping, you're not breathing. If you're not breathing, you're not sleeping, and then you have all these issues going on.
Yeah, it's definitely bi-directional, that relationship. And it's 100% not even just like an American societal thing. This is a global issue. Like the World Health
Oh, 100%.
Organization in 2019 declared sleep deprivation a global epidemic, where 60% of our global population is not getting adequate sleep.
Yeah.
60%.
60%. That's a lot of people, Carice.
Yeah.
Yeah, I was just in Pakistan and I guard my sleep. Usually in bed by 9:30, and then I'll sleep, good 8 hours. And I went to Pakistan on a mission trip. I thought I was going to die. They're up to like 2 a.m.
Oh, wow.
And then they're up like of course, I didn't sleep because I can't go to sleep that late, and then you're not getting good sleep. So I was awake like at 6 a.m. So, they just don't get any sleep there. I'm like, why are you doing this? Well, we have to work really hard because, there's so much poverty. We have to work really hard. And
Yeah.
it's just it's the wrong kind of thinking.
Yeah. It's
Sure.
a little backwards,
It
right?
is
Like
so
you can't
backwards. We
work
have to
as hard.
sleep well
Yeah.
so that we can be more productive later. And it took me a long time to learn that. I was a single mom for a long time and, working two jobs and like push, 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 push. And then your body crashes and you're like, well, that was stupid.
Yeah. Yeah. And it's women, we do it a lot to ourselves,
Oh, yeah.
where
Because
we
we have
feel
our
like we have
family,
to,
we take care of
yeah,
everybody. Yeah.
exactly. Exactly.
Yeah. You have to get up early to get all the laundry done because then you have to go to work for the day and then you have to come home. You have to make supper and you have ball games to go to. And I know I work with so many women. I'm sure you do too. They're like, I just don't have time. But I'm
Right.
like, so do you want to choose to take a rest or do you want your body to choose? Because when your body chooses, it's not so much fun.
Exactly.
Yeah. Can we switch to like kind of shift a little bit to babies and like tongue
Yeah,
ties and how that
absolutely.
affects things? Because I just have a new grandbaby and I get a lot of mamas in here and they're always
Congratulations.
like, it's trouble nursing or their airway. Everybody's like, oh, the baby's snoring. That's not cute,
Not
right?
cute.
And so
No,
just creating awareness of that. Can you kind of talk to that whole baby tongue tie breathing thing that we need to be paying attention to?
absolutely. So tongue ties are all the rage these days. Everybody's talking about that. Everybody's looking for them. And I think it's absolutely wonderful. I want to start this conversation about tongue ties just saying that there are plenty of people who don't have a tethered frenum, or that's what a tongue tie is, who don't
Mhm.
have that, who have dysfunction. So
Correct.
that is not the, penultimate, like, oh, if my baby doesn't have one, then we won't have any dysfunction. Or if my baby has one and we get rid of it, then they won't have any dysfunction. That's not necessarily the way that that goes. So just want to temper some of the expectations around tongue ties because I think a lot of the conversations tend to be that it's like this magical, wonderful thing. And once
Right.
we remove the frenum, then yay, all is well. And that's not necessarily the case with tongue ties. So a tongue tie, everybody has, all of us, and even after you have a tongue tie release, your body will develop a new one. So you have a string of connective tissue, a frenum, that connects the base of your tongue to the floor of your mouth. Okay. And in some people, it might be very short, it might be too close to the tip of the tongue, like you're
Mm.
not able to adequately mobilize and engage the tongue. So when we think about a baby and breastfeeding, it's so much motor skill that are involved in getting that breast milk
Yes.
of the
Yes.
tissue. Okay. So the tongue has to come up, it has to come over their little gum pad, it has to lift and compress, and then have like this peristaltic or this wave like motion to compress against the breast and get that milk out. And that's a lot of work. If there is a frenum that is restrictive, they might not be able to, one, either, protrude and get that tongue forward so that they can get the breast, but then they might not be able to compress against it adequately or get that wave like motion because there's a tissue that is holding down the tongue. And so they can't get the movement the way that they need to. Some babies need some work with a therapist, like a lactation consultant or
Hmm.
breastfeeding specialist, to help them to get that coordination. Babies don't come out of the womb and all know magically what to do, and that's okay. Sometimes it needs a little help. Sometimes the frenum is the problem, and so after a little bit of functional work, you're like, nope, we can't regenerate these skills. We're going to need to have that procedure to remove that tissue, recover and heal, and get our baby coordinated well. And so ties are something that can be a part of a dysfunctional breastfeeding
Okay.
relationship. It can cause issues where the baby is not getting enough, where they're not pulling enough. And so that can cause issues for the mom, whether it is pain, whether it's mastitis, whether it is, you know, any sort of backing up of the fluids. Like it can cause a lot of issues. I don't want everybody to think that that's the end all be all, because it can cause issues with children too. So it's not
Sure.
even just babies, it's children. And sometimes that can impact the way that their tongue is sitting. And if their tongue is able to sit where I told you before, where proper rest posture is. In adults, there are some people who just compensate really well and they're able to get by, and they may have not known for 50 years of their life that they had a tongue tie, and they feel like they're functioning just fine. That's wonderful. It's a very beautiful thing. If you don't have any dysfunction, you can compensate very well. But tongue ties may or may not be an impacting factor in oral dysfunction.
Gotcha. What, when we go back to breastfeeding a little bit, I have some more questions. So,
Yeah.
what else can impact that the baby's sucking ability outside of the tongue tie?
Outside of the tongue tie, there could be other strains. So I don't think people talk enough about there's so much value in body work for infants and newborns. There could be other strains. So we have the tongue and the frenum of the tongue that connects from the tongue all the way down to the toes, our deep line fascia. And that connective tissue system, the fascia system connecting throughout the whole body, it could be tight at anywhere along that chain. It could be tight in localized areas. They could have torticollis. They can have sort of issues that are going to impact them being able to mobilize and engage and get their mouths open wide enough, or get all of the compressive action and all of the skills that are involved. There's so many skills involved that will allow them to get that breast milk out of the tissue. So there could be any sort of strains in other parts of the body. I think it's
So
a really
how do you get those assessed?
a manual therapist, a craniosacral therapist, chiropractor, uh, cranial osteopath, or a I'm forgetting one, craniosacral therapist, massage therapist, chiropractor. No, the cranial osteopathy. That's massage therapist is what I forgot to say.
Gotcha. Okay. Very good. Could it be the size of their jaw at all or their palate?
It could be. Most babies are born with a recessed jaw.
Okay.
Most babies
Yeah.
are born. They have to make their way through the pelvic system.
Yeah.
And so, you can't intervene too early. You can get in probably as early as 2.5, more likely 3 years old. But their craniofacial structure, the way they're born, that's the way they were intended to be, to make it through
Yeah.
the pelvis as they were coming through the birthing canal.
I love it. That's such great information. Hopefully that's encouraging to some mamas out there who have had issues or, maybe are currently having issues with nursing or anything else you want to add to the nursing component that maybe I haven't asked.
No, I just think it's really important to take them with a grain of salt. I think all of the functional work is super important to do beforehand, because when you see media articles about these tongue tie releases and are they happening too often or
Yeah.
inappropriately or whatever, I think the real conversation needs to be, have you done enough functional work to know that this is definitely the problem?
Right, right. Okay. So one of my main things that I help people with is stress and anxiety. So can you talk about how your breathing affects and your structure and everything affects possibly anxiety?
I think we've all known for a long time that breathing and anxiety are very closely related. I mean, if you
Hmm.
have an appointment with a psychiatrist or a psychologist and you have anxiety, one of the first things they're going to do is teach you breathing exercises. Like
Right.
that's how you are able to start to regulate that. And breathing and breath work is an incredible way to get you out of certain states. So if you are in a more sympathetic tone, the autonomic nervous system, I'm talking about, if you're in more of a sympathetic tone and you're more ramped up and your breathing's more shallow, like breath work can definitely take you into parasympathetic tone. And there are some times where you need to be in sympathetic tone, and you can force that through breath work. And so being able to kind of regulate in between these states of being and have more control over your body system is how we're really able to help people overcome certain states of anxiety. So you get more awareness of your breath, you get more in tune with your breath, you're able to control your breath, you're able to control and regulate that autonomic nervous system and allow your body to come to the state that you want it to be in.
Right. That is so good. Like breathing is, well, I mean, clearly it's foundational. So we have to breathe in order to live, right?
Oh yeah. Yeah.
Yeah. Do you do any online consultation?
I do. I
Tell
do.
us about that.
So I see people all over the world. I do free consultations. It's available through my website. I'm sure that'll be in the show notes.
Well, mhm.
But my website, you can just go on, you can just book an appointment at any time that would make you feel good. I'm happy to talk to anybody at any time about myofunctional therapy and if it's the next best step, because it's not necessarily the next best step for everyone. There's a lot of things that could be in the way, or a lot of things that we'd like to kind of rule out, such as an ear, nose, throat doctor may have told you that you have, polyps or certain things that need to be resolved first. And so myofunctional therapy would just be like a big roadblock. And so I
Right.
wouldn't be your first step, right? It would be resolving that and then coming back and we can teach you functional patterns for breathing and really get that going in the right way. So I'm happy to talk to anybody about it at any point in time at absolutely no charge. I do free consultations. You just schedule it online and then we work virtually and it's absolutely powerful. I
Love
think
it.
there's nothing like what COVID has done for us and allowed us all to really get on Zoom and everybody knows how to
Yeah.
work that to be able to do the work that we do virtually and from a distance.
Ah, Karese, that is amazing. Is there anything that you want to leave the audience with?
I think it's important to advocate for yourself. So that's the one thing that I always like to, kind of leave there at the end. We tie it with a nice bow. Advocate for yourself. If ever you feel like something's not right or you've gotten a certain answer about things, I can't tell you how many times I was told during my journey with my children that, they'll grow out of it or it'll be fine. They'll grow out of it. This is just a phase. Mm-mm. You don't want to let those things sit. If it doesn't feel good and doesn't feel right, advocate for yourself or your child. And there are people who are willing to listen and who do have other answers. And so seek out those other answers.
I love it. It's so, so important to be your own advocate because nobody else can really do that as well as
Yep.
you can, right? So do
Yep.
it while you can so you don't need somebody else's help.
Yes.
Yes. Karese, thank you so much. This was very insightful, and I appreciate all your knowledge and just being willing to come and love on my people for a while. So thank you.
Thank you so much for having me. I appreciate it.
Awesome. Well, thank you everyone for listening. Make sure you like, subscribe, and share this video because I know you know somebody who needs this. So make sure you do that. God bless each and every one of you, and I will see you in the next episode.